Hi, my name is Dr Luke Madden. I'm one of the osteopaths at Health House Clinics. I'm joined by Dr Kate Begley, one of our chiropractors at Health House Clinics. We've done a couple of videos before showing you one, how to make a back ball out of some duct tape and a couple of tennis balls. We did a video on how to release the glutes using a couple of tennis balls, and now we're going to get to use the back ball that we've actually made. I don't know if that's trademarked, if I'm supposed to say back ball. The Health House Clinics tennis back ball that we're going to use. So we're going to start to do some release work on Caitlin's lower back. Let's pretend that she presented with some lower back pain like many of you folks out there. Let's have you lying on your back for me with your head up this way, please. So whenever we're doing any release work with tennis balls or back balls, we always generally want knees bent so that we can flatten the lower back towards the table. We're going to take this back ball and we can either place it on the sacrum, which is the triangle bone at the bottom of the pelvis, or we can place it directly into your lower back. Now the reason we use the two tennis balls and the tape in between is there's a thing called the spinous process, which is the part that sticks out at the back of the vertebra. It will sit in this little gap, which allows these two balls to drive up into the erectus spinae, which is the muscle that holds your spine upright. So Caitlin, I'm going to ask you to lift your hips up. We're going to place this back ball just there and back down. You might need to jimmy if I haven't correctly placed. We're good to go?
We're good to go.
What are you feeling? Tell the camera what you're feeling. Just light pressure?
Light pressure at the
Okay.
moment, yeah.
And we're just off your sacrum, so around the L5 mark. Alright, so we can stay here and just do a gentle release as is, or we can start to increase pressure. You can also do this without creating the back ball. If you're sore on one side, you can just use one tennis ball and place that under the side. So, going back to our Health House Clinics back ball, DIY back ball, we can stay here or we can start to load the pressure. So I want to introduce pressure load. So let's say Caitlin presented with some left-sided lower back pain. I want to get you to raise this off the bed and hold it, okay? And now we're putting more pressure through that left side that you can feel. We can also start to rotate side to side, or we can flex and extend depending on how much pressure we want to load through that ball. If we want to do both sides, we bring both knees up. And you can either just stay there and inhibit the muscle. Often with lower back pain, the nerve that supplies the disc or the segment will also supply the muscle behind it. So if the disc or facet or segment is irritated, then the muscles will lock up and go into a spasm. If we can put pressure into that muscle, we inhibit the muscle, which basically means turn it off, and the muscle can release and go back to its normal tension. So Caitlin can either stay here in a pretty comfortable, relaxed position, or once the pain has gone, we can start to mobilize our lower back in this position. So you can either go side to side, tell the camera what you're feeling.
Definitely more pressure as you move across.
We can also go forwards and backwards, right? You can, if you want, alternate. Feeling good?
That one feels good.
So here we're also getting a stretch of those muscles as well. And if you're stretching while inhibiting, you're both turning the nerve supply off that muscle from the brain, so we're dampening down how much noise that muscle is making, but we're also inducing elongation or stretching of that muscle. And that's how you can release your lower back. As I said, if it was one-sided, you can put a tennis ball under one side, but using our simple homemade, let's give a value, $1.37 Health House Clinics back ball, we can release a lot of our lower back. And if you combine that with the tennis ball glute video we did before, you can pretty much alleviate most of your lower back symptoms from the comfort of your own home. That's all we have for today, or for now. The next video is how we're going to mobilize through the thoracic spine using a Swiss ball and a foam roller. So click on the next video. Yeah. All right.